Okay, 2 points of business first. The first point is if you would like to, anyone who's sitting in the back on this side or this side, if you'd like to come to the table where there's no name card, please come. That would be great. Excellent. Second point of business before we jump in is we are planning to record this meeting for note-taking purposes. Is that okay with everyone? Hearing no objections, I'd like to be the first to thank everyone for coming to the first APEC policy dialogue to end the HIV epidemic. And I'd like to turn it immediately over to our APEC Health Working Group Chair, Dr. Victor Campos, to kick off the meeting.
Thank you so much. Hello, hello. Thank you. Thank you so much, Eric. Distinguished colleagues and esteemed delegates and partners across the government, academia, and civil society, and also the private sector. It is a great honor to welcome you to this first APEC policy dialogue to end the HIV epidemic. On behalf of the APEC Health Working Group, I would like to thank you for your presence and your shared commitment to a healthier, more inclusive APEC region. As you know, over the past 4 decades, we have made extraordinary progress in fighting HIV, and many people living with HIV now are living with dignity and longevity. But yet, let me be clear, this HIV epidemic is far from over. Despite scientific breakthroughs like the recent lenacapavir injectable, too many people in our region are still being left behind, particularly young people, women, key populations, and those facing stigma, poverty, or criminalizations, especially in rural, remote areas and border areas. As this draft APEC issues paper makes clear, the APEC region is not on track to meet these 95-95-95 targets or the global goal of 90% reduction in new HIV infections by 2030. If we do not act decisively now, we are going to risk losing the momentum of recent decades and failing the end of this pandemic in our lifetime, which is more possible than ever with recent innovations in long-acting treatments and prevention through pre-exposure prophylaxis or PrEP, like lenacapavir, cabotegravir, even Truvada. Today marks a turning point. With our 21 economies present today, represented here, APEC has this unique opportunity to align policy, to align innovation, and investment across borders to accelerate progress. We must confront these legal and financial barriers that still hinder access to testing, treatment, and prevention. We must seize the opportunities presented by new diagnostics, long-acting therapies, and integrative models of care. We are here at this dialogue to shape the APEC action plan that empowers each economy to translate commitment into concrete implementation and ensures that no one is left behind. Ending the HIV epidemic is not responsibility for the health sector alone. It requires leadership from across the government, across justice, education, labor, finance, and from every corner of the civil society. We must engage with affected communities, strengthen regional collaboration, and partner with the private sector to unlock new solutions and mobilize sustainable funding. Shared leadership also meaning listening, especially to those most affected, and ensuring that APEC's response is grounded in inclusion, dignity, and equity. As chair, I pledge our commitment to this effort. Peru is proud to be a co-sponsor of these initiatives along Chile, Singapore, Chinese Taipei, and Thailand. We are grateful for our project overseers and APEC HIV experts and APEC HIV Industry Coalition, our colleagues from the UNAIDS, and also the stakeholders involved. I hope this dialogue marks the beginning of renewed political commitment, a strategic partnership, and an APEC region united to end the HIV pandemic once and for all. Thank you very much. To turn the floor to Dr. Leonardo Chanqueo. He is the director of the National Program for Prevention and Control of HIV/AIDS and STIs at the Ministry of Health of Chile. Dr. Leonardo, the floor is yours.
Good afternoon. Good afternoon. It's a privilege for me to welcome all of you to this milestone gathering, the first ever APEC policy dialogue dedicated to ending the HIV epidemic. I speak to you today not only as a project overseer of APEC project, but also as someone deeply involved in the HIV response in my own economy, Chile. I know firsthand how difficult and how urgent it is to move from vision to implementation, from commitment to measurable results for people living with HIV. Let us begin being clear about the scale and nature of challenge before us. While APEC economies have made progress in expanding access to the antiretroviral therapy and reducing AIDS-related death, we are not on track to meet the 95-95-95 targets or the goal of reducing HIV incidence by 90% by 2030. The epidemic in our region remains highly concentrated in key population, men who have sex with men, transgender people, sex workers, people who use drugs, and young people. These groups face a complex web of stigma, legal barriers, and policy gaps that continue to block access to life-saving service. The data is serving. In several APEC economies, new infections are rising. Prevention coverage, especially for tools like pre-exposure prophylaxis, PrEP, remains far below target. Testing and treatment service are not reaching the people who need the most, and donor support is declining, putting the sustainability of community-led programs at risk. We will hear more about this from UNAIDS in our next session. In response to this challenge, Chile, together with co-sponsors, as I mentioned before, from Japan, Peru, Singapore, Chinese Taipei, and Thailand, proposed a new self-funded APEC project titled Accelerating Progress Toward the Triple 95 Targets Across APEC Economies in Pursuit of Universal Health Coverage. This project was endorsed by the APEC Health Working Group in early February. The initiative has three main objectives. First, to identify and analyze persistent barriers to progress on HIV across APEC economies. Second, to convene the police dialogue to share solutions and mobilize collaboration. And finally, develop a practical, actionable APEC action plan to end the HIV epidemic. To inform this work, we first assembled an APEC HIV expert network. As of today, we have 31 experts from 14 economies representing government, academia, also clinicians, industry, multilateral organizations like UNAIDS, civil society, and people living with HIV. We conducted a wide-ranging review and consultation process, culminated in the APEC issues paper to end the HIV epidemic, which we are pleased to share with you today. The paper highlights 6 major barriers to progress. 1. Deprioritization of HIV as a public health issue and insufficient multi-sectoral engagement. Restrictive laws and policies that exclude and criminalize. Inadequate testing coverage and weak linkage to care systems. Challenges in treatment initiation and retention. Limited access and underutilization of prevention tools, as I mentioned before, as PrEP and also harm reduction, and insufficient and unsustainable funding for HIV programs. Yet the paper also shows that these barriers are not impossible to address. Across the regions, economies have piloted both of promising reform, ranging from age of consent law revision to the same-day antiretroviral therapy, from integrating PrEP into the universal health coverage to partnering with communities on innovative outreach. The police dialogue is our opportunity to share this success and to confront the gaps. The discussion we have today will directly inform the forthcoming APEC action plan and help shape the new phase of regional HIV cooperation. Together, we can write a new chapter in the HIV response, led by evidence, equity, and shared responsibility. Thank you so much. So, it's now my pleasure to turn the floor to Dr. Brigitte Kenum, Senior Regional Advisor and Team of Lead for Science, Systems and Service for All at UNAIDS Asia Pacific.
Thank you. Can you hear me?
Yes, we can.
Okay, thank you. Thank you so much. And again, thank you for inviting UNAIDS to join this important meeting. Can I have the slide, please? Or shall I do it from my hand?
You're pulling up the slides now, Bridget.
Thank you so much. Thank you. So we have been requested by the organizers to present the HIV response in APEC economies, and I'm going to walk you through the presentation right now. Next slide, please. So, dear partners, this dialogue on the progress of APEC economies toward ending AIDS as a public health threat is timely, very timely. Without urgent action, we face a resurgence of the HIV pandemic. Obviously, this would be a public health crisis with rising new infections and deaths. But it would also be a social and economic crisis, fractured families and communities, unsustainable future treatment costs, and a shrinking labor force. These are the existential threats that spurred the world into action towards an AIDS-free generation. But now, our progress is under threat. If you look at the slide, you can see the orange lines in these graphs, which are 5-year projections for new infections and AIDS-related deaths globally if lost funding does not return. transmissions and mortality could climb to levels we haven't seen for 20 years. Many traditional funders have reduced their investments. Domestic financing is often inadequate, and most countries have not implemented all relevant best practices. Now we have a small window of opportunity to correct course. Next slide, please. First, we will discuss regional realities. Next slide, please. As you know, the APEC economies span several regions with diverse fiscal and social dynamics. But there is one shared reality, the need for an HIV prevention revolution. The global 40% decline, the global 40% decline in new infections since 2010 is skewed by African countries. As this graph shows, all the regions to which APEC economies belong lag behind the worldwide average. The reductions in the Caribbean, Asia Pacific, and North America are sluggish. Alarmingly, we have growing overall epidemics in Eastern Europe, Central Asia, and Latin America. New HIV infections are like a leaking tap. Every drop in the bucket is another individual requiring lifelong treatment. The only way to ensure that we have an affordable HIV response in the future is to shorten the path. Next slide, please. Here is a look at trends in 10 countries from 2010 to 2024. The green bars shows that New Zealand, Vietnam, Thailand, Malaysia, Indonesia have reduced new infections by half or more. On the other hand, we see a 23% increase in Mexico, 34% in Chile, 51% in Peru, and 84% in Papua New Guinea. In the Philippines, there were 6 times as many new infections last year as there were in 2010. As we know, epidemics are not contained by our borders. Rising new infections in one place threaten regional health security. In Eastern Europe, Central Asia, we know that less than 3/4 of people living with HIV know their status, and just half are on treatment. In the other 3 regions shown here, 1/3 of people living with HIV have not achieved a suppressed viral load. This means we are not yet optimizing the power of treatment as prevention. Altogether, the regions to which APEC economies belong account for half of the world's unmet HIV treatment need. On one end, this is a challenge of treatment scale-up, ensuring access to decentralized services. But when people do not feel safe while using HIV services, they often disappear into the shadows. This is why the conversation about prioritization in a resource-constrained context cannot stop at treatment. Work to reduce stigma and discrimination saves lives and prevents new infections. Next slide, please. The next priority is testing and treatment coverage for people already living with HIV. A person living with HIV who achieves an undetectable viral load through treatment has 0 chance of infecting a sexual partner. This is the value of the Global AIDS Strategy targets relating to early diagnosis, immediate treatment, and viral suppression. The approach not only saves lives, but prevents new infections. Once again, all our regions lag behind the global average of 87% aware of their status, 77% on treatment, and 73% virally suppressed. In all these graphs, The yellow portion represents the people we must reach to achieve the testing and treatment targets that come due by the end of this year. Realistically, as Dr. Leonardo and Dr. Victor mentioned previously, the 2025 targets will be missed. Next slide, please. This slide shows the distribution of estimated resource needs by intervention and by region by 2030. I would like to draw your attention to the blue bar closer to the top, which relates to societal enablers. We cannot optimize investment in service delivery without attention paid to the legal, policy, and structural barriers that block people's access. First, the criminalization of key populations. Many APEC economies maintain punitive laws targeting sex work, drug use, and same-sex relations, which deter access to HIV services and perpetuate stigma. Another point around legal frameworks that often fail to protect the rights of people living with HIV and key populations, limiting their ability to seek care without fear of discrimination or prosecution. This is compounded by inadequate or enforced anti-discrimination laws. These leave individuals vulnerable to stigma in healthcare, employment, and education settings. There are also legal and policy gaps in addressing gender-based violence and ensuring sexual and reproductive rights. Work is urgently needed to address barriers to youth service access. These include age of consent laws and a lack of youth-friendly policies. Community-led organizations often lack formal recognition, limiting their ability to receive funding, deliver services, and participate in national HIV governance. Finally, we need stronger accountability mechanisms. Safeguards such as legal aid, redress systems, and community-led monitoring increase transparency and bolster trust in health systems. Next slide, please. Now, I will give an overview of the next global AIDS strategy. Next slide, please. The next strategy will guide governments, communities, civil society, donors, and other stakeholders through the next phase of the HIV response. It presents a call to action and shared commitment to reimagine how we can achieve our collective goals by adapting to a changing global context. The strategy sets out 3 priorities that are essential to achieving this goal. If you look at the slide, to the top, we have country-led resilient systems ready for the future. To the left, leadership, service delivery, and accountability. And to the right, equity, dignity, and access to HIV testing, treatment, and prevention, free from societal barriers. Next slide, please. Over the last months, as UNAIDS, we have consulted with stakeholders to determine the way forward for the region. And so far, you can see from the slide, so far we have 6 umbrella recommendations. First, we need a more people-centered and right-based response. This requires us to ensure dignity, equity, and inclusion, particularly relating to people living with HIV and the key populations. Second, we should integrate services, getting the most out of every interaction and investment. HIV must be embedded within universal health coverage, sexual and reproductive health, mental health, and harm reduction. Third, community work should be fully integrated, resourced, and enabled as a central pillar of the HIV response. To do this, we must create the legal and policy space for communities to do their work, including inclusive governance, sustained funding, and community-led accountability. Fourth is innovation and access. We must scale innovations such as long-acting PrEP, HIV self-testing, and digital tools to present people with more options and close service gaps. Fifth, sustainability planning is required to ensure policy and programmatic priorities are funded into the future. We need accelerated domestic resource mobilization with strategies for leveraging the private sector. We also need a strategy to maintain critical external financing where possible. And finally, six, there must be legal and policy reform. This involves dismantling punitive laws and reducing stigma to enable inclusive and right-based services. Next slide, please. To close, I would like to paint a picture of what a sustainable HIV response looks like with reference to a few APEC members. Thailand is a model for integrating HIV services into universal health coverage and scaling up social contracting to leverage the reach of community organizations. They already cover funding for over 90% of their HIV response and have advanced work on developing their sustainability roadmap. India offers an example of progressive public policy to uphold the human rights of people living with HIV and key populations, including men who have sex with men, sex workers, and transgender people. In Vietnam, we have an example of integrating HIV treatment into the National Health Insurance Scheme to ensure sustainability. And in Malaysia, we find an example of diverse domestic resource mobilization that targets the private sector. Dear partners, dear friends, we must act now to fund and implement all relevant best practices. Future population and economies will thank us. Thank you so much for your attention. Over back to you, Mr. Chair.
Thank you so much, Bridget, for that wonderful context setting and also a great sort of sneak peek at the global strategy and for laying all that out very clearly. We appreciate your participation today. I'm going to invite my colleagues, Dr. Campos and Dr. Chanqueo, to take their name cards and move to their respective economies as we prepare for the next session. And I'll invite my other colleagues, Dan Murphy and Robert Grant, to grab their name cards and move to the head table. And while they're doing that, I'll just inform you that our next session is titled Overcoming Barriers and Scaling Solutions and Advancing Public-Private Partnerships. So we'll be focusing on more of the practical levers that we started to hear about from UNAIDS that can accelerate progress in APEC economies towards the 95 targets and the reduction in incidence target from UNGA. We're fortunate to be joined today by two senior industry leaders who bring deep experience across sectors and geographies. And while they currently represent industry, both have held positions in government and in Dan's case, also in the patient advocacy space. And so on that point, let me say at the outset that we recognize that a complete response to HIV must center around people living with HIV and their communities. We did extend some invitations to several additional speakers, including civil society members and people living with HIV. And unfortunately, as often happens in August at the height of vacation and holiday season, there were some scheduling difficulties, and so they're unable to be here today. But rest assured, the voices of people living with HIV, their insights, have informed this dialogue, have informed the issues paper, and they will continue to shape the APEC action plan moving forward. So with that, first, I'm pleased to turn the floor over to Dan Murphy, Senior Director for Global Policy at Gilead Sciences, which currently chairs the APEC HIV Industry Coalition. Dan, your opening remarks, please.
Thank you, Eric. Hear me. It's a great honor to be here and to represent Gilead. The previous speakers spoke about this as an opportunity to learn, to listen. Gilead is here to do precisely that. As you know, Gilead Sciences is a global biotech company that specializes in discovering and developing medicines that address unmet needs. In HIV, we, I think, have been at the forefront of that development, and we have had 12 medications, including the first tablet regimen, the first antiretroviral treatment for pre-exposure prophylaxis, the first long-acting PrEP, administered twice yearly, and Gilead remains committed to advancing innovative therapies and expanding access and care to help end the HIV epidemic for everyone, everywhere. The previous speakers spoke very eloquently about some of the data. Brigitte, in particular, at the end there, spoke about some of the data in the region. I will just emphasize and reiterate some of that. Despite the considerable progress that Victor mentioned in expanding antiretroviral therapy and increasing awareness of HIV status, the global HIV epidemic remains a public health challenge. Globally, as we know from the recent UNAIDS report, 1.3 million people acquired HIV in 2024. APEC's progress on UNAIDS 95-95 treatment cascade, or 95-95-95 treatment cascade, is mixed, as we just heard, with overall levels still well below the targets. In Asia and the Pacific, the latest figures estimate that 78%, only 78% of people living with HIV know their status, 60% are on antiretroviral therapy, and only 65% have a suppressed viral load. Remember, the targets, which all the governments represented, all the economies that have represented here, have signed up to on 95, 95, 95. An example is in Latin America, there were 120,000 new infections in 2023, a 9% increase from 2010, and antiretroviral treatment coverage amongst people living with HIV was only 73%. We believe that the APEC economies have a number of areas alongside industry and the wider community to focus on. Funding and political prioritization. As has been apparent and clear over the last few months, this is of critical and pressing urgency. These data, which we've heard from a number of speakers today, demonstrate that HIV remains an urgent public health threat across the globe and the region, and the epidemic is far from over. Funding for testing, treatment, and prevention, including for PrEP, needs to be maintained, and we would urge APEC economies to set this out in its action plan to ensure that sufficient funding is available to meet the goals of ending the HIV epidemic, which the economies have signed up to. Prevention. We heard a little bit about prevention, and I think both Leonardo and Victor and Brigitte spoke about prevention to an extent. But the reality is that prevention targets and awareness of prevention is not nearly at the same level as it is for treatment. We believe that prevention should be a strategic imperative, and HIV prevention must be given equal footing with both testing and treatment. There needs to be a bold and sustained focus on prevention, including new targets, and we advocate for ambitious and measurable prevention targets, including a global target of 95% access to effective combination prevention, and a measurable increase in PrEP uptake. We would support a target, and it's interesting hearing from Brigitte about the new UNAIDS strategy. We would support a target of 50% PrEP use for those with a high risk of HIV acquisition. That is clearly not currently the case. ART, and I think this was also mentioned by you, Leo, ART also supports treatment as prevention, and it's critically important that people are diagnosed. However, of the 6.7 million people who were living with HIV in Asia and the Pacific in 2023, only 71% of people with HIV were on ART, below the global average of 77%. It is important that HIV prevention is tailored to suit the needs of many different individuals and communities to increase uptake. There is no one size fits all. The WHO's global HIV strategy highlights the need for diverse prevention options, including ART for people living with HIV, alongside PrEP, especially in underserved populations. And we heard from other speakers about those key populations. It is encouraging to see examples of progress in the APEC economies. For example, Korea's Disease Control Agency, and I think we may have colleagues from Korea's CDC, have been actively supporting PrEP through government funding since last year. This has helped expand access in a short time in a country where PrEP use was previously minimal. Reality is there are still very few people in Korea even who are on PrEP, and this figure and more awareness of that needs to be made. This demonstrates how proactive government leadership, such as we've seen in Korea, can protect communities and advance HIV elimination. We hope more governments will take similar steps towards our shared goal of ending the epidemic. Taiwan is another country which is well represented here today, and the country introduced PrEP in a phased and strategic manner, beginning in 2016 with pilot programs, and in 2022 PrEP became more widely available through public health clinics and hospitals. And there are now ongoing efforts to integrate it into broader HIV prevention strategies. We also know that government funding, wider funding for PrEP, is not sufficient as currently, and part of today and part of what we need to ensure is the greater funding for these preventative and PrEP options. And while HIV prevention program and strategies can differ among countries, we do know from evidence that taking a daily pill for PrEP may not be right for everyone. It is for some, but it may not be right for everyone. That's why in all of the geographies, person-centric solutions that meet individual needs can offer possibilities to improve uptake and adherence. And it was encouraging to hear from Victor talking about the opportunities that long-acting PrEP and indeed long-acting treatment offer. And this presents a significant innovation in HIV prevention. And it was encouraging to hear Brigitte talk about the new UNAIDS strategy and the role of innovations such as long-acting PrEP, and lenacapavir in particular, I think was referred to. I'll come shortly to the end. I want to talk a little bit about accelerating testing and linkage to care. It's important that we improve strategies for HIV diagnosis, testing and linkage to care. And for example, we have strategies like self-testing and emergency room opt-out testing, which has been very successful, particularly in England. I live in the US, but some may notice my accent. I'm originally from the UK. In England, the ED opt-out, the emergency room opt-out testing program, has proven to be successful and saw some impressive results. I won't go through the data along that, but it is impressive, and I encourage countries to implement an ED opt-out testing program wherever possible. We would also argue and urge the economies for rapid treatment initiation after diagnosis. And this needs not only to be a policy, but also needs to be applied across countries. We find that often there is a policy in place, but it's not actually implemented. We know that rapid treatment initiation leads to improved clinical outcomes, faster viral suppression, increased linkage to and retention in care, and supports public health goals and the U equals U strategies that Jeet spoke about. In this region, Taiwan has been a leader on Rapid Start, additionally to streamline HIV testing and reduce waiting times. And the Taiwan CDC announced in 2009 that it had partnered with 12 hospitals to offer one-stop anonymous rapid HIV testing. We also know that, and we applaud South Korea's same-day ART policy, which transitioned from a pilot program in 2024 to a fixed policy earlier this year. As you know, and as has been spoken about by another speakers, stigma and the legal barriers continue to limit access to testing, treatment, prevention, and these barriers have to be addressed in policy change by APEC and others. Ensuring quality treatment for all people living with HIV. The reality is that not enough people with HIV are able to access the highest level of care. We know that people will live, and people with HIV must not be left behind. We do possess the medical tools to help ensure a high quality of life and to design services that meet evolving needs. Gilead Sciences supports a long-term, sustainable approach to HIV treatment grounded in health inclusion, innovation, and resilience, emphasizing durable viral suppression through high-quality ART regimens and management of comorbidities. Critically, and I think this is going to be an important part of the action plan for APEC, monitoring drug resistance and equitable access to the latest treatment innovations. And we encourage the APEC economies to have targets on health-related quality of life and long-term success for people living with HIV. In conclusion, we are very grateful, Gilead's very grateful to have the opportunity to speak with you all today, to be part of this listening exercise, to be part of this innovative dialogue. There is a real opportunity, I think, in the APEC economies, in the APEC region, to drive forward some of these innovations, and we will work with you in partnership to achieve that. Thank you.
Thank you very much, Dan. I particularly appreciate we'll get into some time for some questions later, but I appreciate your emphasis on measurability. I think that's key. What you don't measure, you can't improve. And no one size fits all. I think that's a very common and well-known APEC approach. No one size fits all, both at the policy level, but also at the therapeutic individual approach level, as you said, around once-a-day PrEP. Next, I'd like to invite Robert Grant, Director for International Government Affairs at MSD, Merck Sharp Dome, also a member of the APEC HIV Industry Coalition. Robert, your remarks, please, and then we'll get into a little bit of discussion.
Thank you very much, Eric. And I'd like to thank the organizers, the Korean hosts, who are doing a really wonderful job so far. So thank you very much indeed. Many thanks. It's excellent to see the chair of the Health Working Group here, Victor, and thanks very much, Leo, as well from Chile and the co-sponsoring economies. This is a real privilege to be here with you all today. Thank you very much for having us. As Eric said, yeah, I'm from Merck & Co., which is MSD everywhere outside of the United States and Canada. For over 40 years, since the beginning of the HIV epidemic, MSD has been engaged in research of various kinds, development efforts that have transformed outcomes for people with HIV. Throughout this time, we've worked very closely with governments, economies, academic and clinical experts, patients and civil society, and multilateral partners to support global efforts to reduce the incidence and burden of HIV. MSD remains committed to collaborate efforts to achieve global goals to end AIDS as a public health threat by 2030. And I'm sure we will hear more from economies over the course of the meeting, in addition to what our speakers have already gone over. But progress shows what is possible when all stakeholders unite behind a common vision. This focus has driven investment and innovation and significant gains for people living with HIV around the region and around the world. And in even more positive news, we will soon have a new long-acting tool for HIV treatment and prevention, including an oral, once-monthly HIV PrEP that will be starting clinical trials in the region in the coming months. All of this can accelerate progress towards ending the epidemic. However, as we've heard from Dan and a number of the other speakers, and as we will discuss further today, this progress and this opportunity are at risk if we allow ourselves to lose our focus on HIV. A quarter of new HIV infections globally are within APEC economies. Now is not the time to take our foot off of the accelerator. Instead, we need to reprioritize HIV and redouble our efforts to reach those who have not been reached with HIV treatment and prevention services. Given the challenges across the broader environment and funding constraints, this is not going to be easy. It's going to require strong engagement and partnership across all of the stakeholders represented here and others, particularly the representatives from the APEC economies in the room and those that are dialing in. We thank you for that. I'm very encouraged. I'm sure a number of us that will be speaking today will be encouraged by the commitments of APEC economies. The fact that there is a groundswell of interest in creating an APEC action plan is a huge step in itself, and we should recognize that. And as I say, we should thank Chile, Peru, and others for their leadership in helping to create it. So thank you. I am encouraged by this commitment, and I'm looking forward to continuing to partner with APEC economies on this important work through various new APEC mechanisms, including this potential action plan. MSD remains steadfast in its commitment to being a part of this broader partnership to end the HIV epidemic for everyone, everywhere, as Dan said. Thank you very much.
Thank you very much, Robert. I think what we just heard from both speakers is that we both highlighted both the urgency of the task at hand and the opportunity. Scientific progress has clearly brought us within reach of ending HIV as a public health threat, which is incredible just to say out loud. But not just science, communities of different stakeholders advancing that science and also translating that science into clinical impact and policy impact. But going further will clearly require deliberate political decisions, which you both highlighted, policy choices, systems level readiness, which many of the economies have great examples of efforts towards this end, and deeper collaboration across sectors. And that I think is a terrific goal and truly the spirit of APEC. So in the time that we have remaining, let's turn to a few questions, a couple questions per panelist for each of you, to just emphasize and dig a little bit more into some of your remarks. Robert, you mentioned MSD has a long history of working with governments, multilateral partners, civil society on HIV. MSD is also a longtime partner to APEC in other projects on vaccines, on cervical cancer. So from your perspective, why is this multi-stakeholder collaboration that we so well demonstrate in APEC so important for HIV? And how specifically can APEC help sustain focus on HIV amid other competing health priorities?
Very much, Eric. That's a really great question. I think what we're increasingly seeing is that economies in APEC and governments around the world have signed up to the very ambitious goals set out by UNAIDS. But increasingly, there's no longer the same feeling of urgency by certain economies. There's a feeling that the worst has passed, progress has been made, and that governments can and must necessarily balance priorities, and that perhaps combating the HIV epidemic is not one of those compared to others. And that's extremely unfortunate, not only because a lot of the data is not going in the right direction, not only because we have the tools and we will have even more effective tools in the short term, which is, as I said, a very exciting and important development. But I think even within the APEC economies, there's a great diversity and disparity. Some economies are doing very well, as we've seen and heard. Some are not doing as well for various reasons. And thank you, Eric, for pointing out that MSD has a long history of working collaboratively within APEC. A couple of examples do spring to mind. Certainly on vaccines. Vaccines are generally recognized as being a hugely important investment that provides an enormous return on that investment. Almost all APEC economies recognize the importance of that, and by coming together in two ways, on the action plan on immunization across the life course, which focuses on vaccination for adults as well as for children, which is an important distinction, but then also the roadmap on cervical cancer elimination, which a number of us are hoping will be renewed during this year. Both are excellent, I think, examples of how APEC economies can agree broad goals, but then also really show and hold each other responsible for making progress, and by doing so in a way that is collaborative and cooperative, and follows similar sorts of approaches. Approaches, nevertheless, that are going to diverge and vary depending on the particular circumstance of each economy. But both are, I think, excellent examples of where real and extraordinary progress can and will be made, and it's been done through APEC. So APEC is important. This is a wonderful and important and urgent opportunity for APEC to grasp, and it's extremely exciting that this is the beginning of that. Eric, hope that goes some way to answering.
Excellent, Robert. Yeah, thank you. I appreciate you calling out specifically the action plan on immunization across the life course and the cervical cancer roadmap. I think there are so many great examples in the APEC Health Working Group, which time and time again, if people saw the data from the APEC Secretariat, has one of the highest numbers of self-funded projects in all of APEC, because there's just so much rich interest in working together through APEC projects on key issues. And I think we have a lot of great examples for HIV that we can use, that we can incorporate as we seek to, as a next step, think about developing our own APEC action plan to end the HIV epidemic. Dan, building on that, the question then is, what goes in that plan? You talked a little bit about some specific innovations in HIV prevention and treatment that are evolving in the region. What can governments do now to sort of lay the groundwork for these innovative approaches? You mentioned very specific ones like, I love the emergency room opt-out testing that you've seen in England. The same-day ART in Korea is a great example from our wonderful hosts. Those are good, those are specific, but what's the ingredient before that? What are the enablers that will help economies prepare for, set the stage for those specific innovations in prevention, treatment, testing, care, etc.?
Thanks, Eric. Great question. I want to refer you ask about the enablers. I'd like to refer you to a paper that Gilead commissioned and was written by 3 independent authors. The report was called Going the Extra Mile to End the HIV Epidemic. It was published a year ago. The 3 independent authors, one was a patient, Mercy Shibemba, somebody who had acquired HIV at childbirth. The second was Dr. Shannon Hader, formerly the Deputy Executive Director of UNAIDS. And the third was Dr. Yonko Tanama, who is a Japanese HIV infectious disease clinician. And in this report, they identified 3 enablers to end the HIV epidemic. Interestingly, Brigitte also talked about enablers. The first enabler, and I think this is really important, is about innovation, is about funding and sustained funding. The reality is that we will not, any of us, achieve these targets and these goals to end the HIV epidemic without funding. And Bridget's excellent slide a few moments ago set out how that funding cuts put at peril the opportunities to end the HIV epidemic by 2030. And what if that analysis by UNAIDS is correct, then we'll see a reverse of any progress that is being made. The second enabler is around innovation, and we've heard about innovation today. Innovation across the care cascade, prevention and treatment, innovation in ART, innovation in PrEP and wider preventative therapies, enhanced modes of administration, such as long-acting. I've been around the HIV world since I was a fairly young man, and sadly lost friends who died of HIV in the mid and late 1980s. And the progress that has been made since then has been remarkable, and that progress has been as a result of a combination of community, of industry, of clinicians, and of course of government. And it's been that innovation has been a critical and central part of that progress. And the third enabler is around new models of care and differentiated service delivery and a person-centered approach. You summed it up yourself, Eric, when you spoke about the fact that one size won't fit all. And it doesn't, right? People have individual needs, and we need PrEP and treatment options that meet those individual needs. And we've heard today from Robert about the opportunities here for new innovations and new treatment options and preventative options coming on the shrine. So those three things, those three enablers, sustained funding, innovation, and differentiated service delivery models, I think are going to be critical to ending the HIV epidemic. And as UNAIDS think about their new strategy, and as the APEC economies think about your action plan and what you're going to drive forward over the next few years, I'd invite you to think about those enablers, which are really going to make the difference.
Thanks, Dan. Certainly something to consider for the action plan across the whole spectrum, right? I think the action plans that really work in APEC, the roadmaps that really work, as the economies know, are not only drafted and developed with multi-stakeholder input, but they cover the whole spectrum of upstream enablers and values and principles, all the way through to very specific approaches, recommendations, action steps, targets. I think a lot for us to think about. So as we think about sort of APEC's next step, as a final question for you, Robert, from your perspective, where can APEC add the most value in regional collaboration on HIV? We have such a wonderful diversity of economies in APEC. It's a magnificent diversity as multilateral fora go. And you spoke to it, Robert. There are economies at every level in terms of progress on HIV. There's a lot we can learn from each other, any which way. So how does APEC harness that diversity? How does APEC address such a wide variance in progress on HIV? What is sort of the opportunity for APEC to add value to this important and urgent opportunity?
Well, that's another great question, Eric. Thank you. I think as much as anything else, to be able to channel and generate or regenerate political will and interest, and to show that, yeah, actually this isn't just an Africa problem, and actually there's some real concerns within the Asia Pacific economies, and yes, some are doing well, and there are some excellent approaches and lessons that can and will be learned from certain economies. Right now, those stories aren't being told. They're not really getting through. Nobody's really paying attention, unless you're very extremely focused on HIV. So being able to reintroduce with urgency HIV back into the public health conversation, to remind economies across the whole Asia Pacific region that this is a real and urgent threat still, and that things can be done, that we can end it. At the moment, we're not going to be able to do that by 2030. We're not really very close, despite the fact that important progress is being made. So this is a great opportunity, I think, for APEC. But in addition to the political will and to generate focus and interest, having a systemic approach where individual economies can show what's working and what isn't, and making sure that it is all APEC economies working together on a joint endeavor. That's what APEC has done effectively, and I see no reason why ending the HIV epidemic couldn't be something that APEC is interested in doing and is capable of doing. And starts here.
Well said, Robert. I appreciate that you point to this political dynamic of APEC. Not only do we have an opportunity for economies to learn from each other, but because of the APEC structure, we have the ability to interface, to advocate for issues with our respective health ministers, and all the way up to presidents and prime ministers and heads of economy. And that's a unique structure in APEC, and one worth pointing out, Robert. I appreciate that you highlighted that there's a political mobilization that APEC can be doing, as well as the technical best practice sharing. Dan, to close us out, looking ahead and getting sort of forward-looking, what do you see as the most important role for industry? Working alongside government, working alongside civil society, people living with HIV, multilateral partners like UNAIDS, WHO, in ensuring that that action plan leads to real implementation, real impact. If an action plan is drafted here over the next 6 months and it's left on a shelf and left to collect dust, that would be a real shame. I think there's a huge opportunity here for APEC to come together to reignite and recommit to ending the HIV epidemic. But how do we ensure that momentum continues beyond 2026 and even beyond?
Thank you, Eric. It's a great question. I mean, I think part of why we're here today is because we want to listen. We want to have a dialogue. We want to be part of that. Industry is one factor in this, but I think we've already spoken about the important role of people living with or at risk of acquiring HIV, the patient community. Industry is part of it, but governments are critical too. Healthcare providers and clinicians. So I think our role as industry is bringing is to an extent enabling some of those conversations. Clearly, MSD, Gilead, others, we invest billions and billions of dollars in research and development in HIV, and will continue to do so. And we have made a commitment as a company that we will invest that money in order to end the HIV epidemic for everyone everywhere. But we know we can't do it alone. And this is why we talk to people, those people in this room and elsewhere, to, I think, convene these conversations, continue these conversations. I want to draw from, though, what Victor said, and I thought it was incredibly important. He said many people are left behind, and these key populations, I think, are vital. And we, as a private sector, are in some respects in a unique position to be having conversations with government, who may listen to what the private sector say, than perhaps if others were saying it. But it's those key populations who are being left behind, who aren't being afforded access to either prevention or treatment, that I think companies like ours can help address that unmet need. with new innovations, which will go, I think, to at least a large extent in ending the HIV epidemic. But look, I mean, critically, the thing to do is to work together. So it's not just Gilead or the industry, but it is all how we can come together. I think APEC has an incredible opportunity. You've heard about the progress that has been made in the region. But reality is there are things that you need to do and can do. And you know, what if it was your legacy? The people in this room, the people listening, what if it was your legacy that you ended HIV for everyone everywhere in your region by 2030? That's something you could probably be very proud of. And I think that is something that you could all achieve.
Thank you for that, Dan. Multi-stakeholder collaboration, indeed, not optional, essential. And APEC is a great illustration of that, a great incubator for that. And we thank both of your companies, Gilead and MSD, for being part of this effort through the APEC HIV Industry Coalition. And we look forward to continuing this work together on the APEC Action Plan as that takes shape, led by governments and academics, clinical experts, patients, people living with HIV, their families, and industry. So appreciate your time and for being with us today. To Dan's final point, we now transition to, I think, one of the probably the most important segment of the dialogue, which is the interventions from APEC economies. We've invited speakers to share challenges, strategies, recommendations to inform the action plan and chart the way forward. This is just the first opportunity to exchange these ideas and these barriers. There will be a 5 to 6 month drafting effort, which I'll talk about after the interventions that will all go on together as we draft this APEC action plan together with many of your experts who have been nominated to the HIV Expert Network, which Dr. Leonardo talked about earlier. So we'll hear first from Chile. Dr. Leonardo, your experience in Chile, please. You have the floor.
Okay, I'm going to start. Thank you, Eric. Again, I'm going to talk about my country. Chile has made substantial progress in achieving the UNAIDS 95 target. As of 2024, 95% of people living with HIV have diagnosed, and 95% of those receiving treatment have achieved viral suppression. In the same year, 4,327 new HIV diagnoses were reported, the lowest number since 2016, despite expanding testing coverage. However, as we mentioned before, key populations continue to experience disproportionate vulnerability and persistent barriers to timely diagnosis and access to service. Stigma and discrimination remain prevalent, and in our country, geographic inequalities in service availability further exacerbate disparities. In particular, men who have sex with men, transgender people, sex workers, incarcerated individuals are among the most unserved. Migrants and young people also face significant challenge in accessing HIV prevention and care. While injectable drugs use not widespread in our economy, there is a growing concern regarding stimulant use and sexualized drug use or chemsex. Our second 95 continues to present a significant challenge, with only 75% of those diagnosed currently on antiretroviral therapy. This gap is attributed to delays in ART initiation, retention issues, and the need for more community-based care delivery that meets the needs of key and vulnerable populations. Chile HIV response is fully financed through domestic resources. The national health system guarantee universal access to HIV diagnosis and treatment, including services delivered at the primary care level. These services are free of charge in the public sector and subject to a maximum copayment of 20% in the private system. While HIV remains a priority under Chile's National Health Strategy for 2030, which aims to reduce incidence among adolescents and adults, civil society organizations and also professionals associations have expressed concern regarding a perceived decline in visibility of the HIV response in our economy. In spite of this challenge, Chile has implemented important measures to strengthen combination HIV prevention, including the free distribution of HIV rapid tests, HIV self-in test, and also pre-exposure prophylaxis PrEP. Access to PrEP has expanded to hospitals in major urban centers and more recently to select primary healthcare centers. Chile also has endorsed the Stigma Index 2.0 and signed the Andean Plan for Elimination and HIV-related Stigma and Discrimination by 2030, reflecting its alignment with regional goals. The standard first-line antiretroviral therapy regime in Chile is a single tablet formulation. Most of the people are using TLD, tenofovir, lamivudine, and dolutegravir, in accordance with WHO and international recommendations. These medications are procured via the PAHO Strategy Fund, promoting both adherence and also cost efficiency. Chile must now advance toward developing a national harm reduction policy to guide and standardize sexual health intervention, including addressing emerging issues such as chemsex, as I mentioned before. In collaboration with academia and civil society, information, education, and communication strategies have been launched to promote safer sexual practices and the prevention of HIV and other STI infections. Additionally, Chile carries out an annual national HIV and STI prevention campaign aimed at raising awareness and promoting key prevention tools. The 2024 campaign reached over 15 million people and received international recognition, including awards of its innovation and content. Chile has also increased critical components of combination prevention, as I mentioned, PrEP and HIV testing through a community health approach grounded in diversity, interculturality, and also human rights. In 2024, a multidisciplinary working group evaluated the effectiveness of doxy-PEP for STI prevention. These findings led to a favorable recommendation, adding a new self-care tool for key population and priority population with the national STI response. The next step for us is develop a clinical practice guideline for its implementation. As a part of our regional commitments, we recommended that the APEC action plan prioritize expanding access to biomedical innovations, as we mentioned, PrEP, doxy-PEP, injectable antiretroviral, as a treatment and also as a prevention, supporting differentiated and community-led service delivery models, promoting knowledge sharing and best practices. To enhance implementation, particularly in lower resource settings, the action plan should also promote technical cooperation and capacity building in consultation with civil society, facilitate pooled procurement, promoting negotiated pricing mechanisms, and address patent-related barriers to ensure equitable and sustainable access to biomedical innovation across the region. And finally, strengthen data system for evidence-based decision-making and epidemiology surveillance. Thank you very much.
Thank you, Chile. Our next intervention will be from the Ministry of Health, Labor, and Welfare of Japan, virtually. Is Dr. Kotani on the line?
Hello. I'm
Hello.
sorry, today as our director is unfortunately unable to attend. So I am Eiko Ishio. I'm a staff in the Department of Infectious Disease Control. We'll be speaking on their behalf. It is an honor to be here, and I appreciate your kind attention. It's okay.
Of course, please proceed.
Okay, thank you. Good afternoon, everyone. Thank you for the opportunity to speak today. It's a great honor to be here among such distinguished colleagues from around the world. Before I begin my presentation, I would like to express my appreciation to the organizer for this valuable conference. Today, I would like to talk about the policies on HIV in Ministry of Health and Labor and Welfare. Specifically, I will briefly explain the basic information about HIV in Japan, the prevention strategies, the policies related to treatment, and some of the latest initiatives currently being implemented. In Japan, around 30% of newly reported HIV infections are diagnosed at the stage when AIDS has already developed. Surveillance policies are required to facilitate early HIV detection. HIV infections is characterized by a high risk of transmission among MSM, sex workers, and so on. Currently, MSM account for the majority of HIV cases in Japan. On the other hand, there are also sufferers of drug-induced HIV infections among people with hemophilia who contracted HIV through unheated blood products contaminated with the virus. Between 1982 and 1985, approximately 30% of hemophilia patients who received these products. Some of these sufferers of drug-induced HIV are still alive today. Therefore, when discussing HIV policy, it's essential not only to focus on general HIV measures, but also to consider the need and circumstances of those affected by drug-induced infections. Regarding the prevention policy, considering a close relationship between sexually transmitted infections, STI, and HIV/AIDS, Japan has established specific guidelines for the prevention of designated infectious disease related to STIs. These guidelines are revised every 5 years to reflect emerging challenges and developments. In terms of public awareness and education, we organized events that are expected to attract the large audiences. For example, we invite well-known public people to promote HIV prevention, aiming to enhance outreach and engagement. We are running a program to help people understand the right of those living with HIV and those infections. It is very important to share correct information and use clear material to help stop prejudice and discriminations. Given that advances in antiretroviral therapy have significantly improved the life expectancy and the quality of life for people living with HIV, the number of patients with HIV is increasing, including many who are aging. To respond to this, we are working to clearly define the role of the key hospital and to strengthen cooperation between regional hospital and specialized HIV treatment centers. This will help us provide more effective and locally tailored care. Regarding as a treatment subsidized, A physical disability certificate will be issued to those who meet the certification criteria for immune dysfunction caused by HIV. Furthermore, we have a support system that helps people with disability live more independently. It reduces their medical expenses by providing financial assistance aimed at easing the physical and mental challenges. With both the self-support subsidized and the disability certificate, medical expenses are significantly reduced, resulted in minimal financial burden for patients. This contributes to successful treatment outcome and support the achievement of U equal U. I will explain the recent new initiative in Japan regarding HIV. In June 2025, the government issues official guidelines for implementing HIV self-sampling, postal testing through public health centers and similar institutions. Until now, postal HIV testing had been available as a private service in the market. However, under the new guideline, HIV postal testing conducted by a public health center and other designated institution that meet the specific criteria will be supported through a cost-sharing scheme. Individual undergoing testing will only be responsible for postage and related minor costs, making HIV testing more affordable and accessible than ever before. While HIV self-sampling postal testing has already been launched as a public health initiative, we aim to continue to explore how best to engage the key population and communities. We remain committed to examining and refining these approaches to ensure long-term impact and inclusivity. So finally, I state about global health frameworks. Ensuring the sustainability of global health frameworks, including HIV countermeasures, is of critical importance. In April of this year, we established the Japan Institution for Health Security, called GIS. Even during the peacetime, we are working to accelerate access to essential medicine and to prepare for the future infectious diseases and outbreak. We are building the ALLIES initiative for Southeast and East Asia, which bring a cooperation with research institutions in Asia, Malaysia, the Philippines, Thailand, Vietnam, and Japan. We are committed to conducting research, including international cooperation, to generate evidence that can inform the HIV-related policy recommendations. Thank you so much for your attention. I hope that today's discussion will contribute to further collaboration and progress in the HIV field. Thank you.
Thank you very much, Japan. Now we will have an intervention from the Ministry of Health of Peru.
Good morning, everyone. Start the meeting. Dr. Carlos Benítez Villafane, Ministry of Health, Peru. Peru reaffirmed its commitment to achieving the 95-95-95 target and reducing new HIV infections, especially in vulnerable and hard to reach population such as transgender women in urban settings and indigenous communities in the Amazonian. Our effort focus on expanding access to HIV prevention, diagnosis, treatment, while addressing persistent stigma and discrimination. Since 2023, Peru has scaled up PrEP implementation and introduced HIV self-testing rapid and diagnostic molecular. Antiretroviral treatment has been decentralized to the primary care level. And we have tailored policy for highly vulnerable groups, including transgender women and Amazonian indigenous people. We welcome APEC role in fostering regional dialogue, supporting technical exchange, and promoting access to biomedical innovation, such as long-acting treatment. We recommended that the APEC action plan emphasis cost effective, evidence basis, and inclusive interventions tailored to local context, particularmente in low resource settings. Peru stands ready to collaborate through peer learning, joint projects, and strategic partnership to accelerate the progress across the regions. Peru is ensured through dedication national budget program, PP 16 and universal health coverage. We also explore innovation financing, such as public-private partnerships and tax forward mechanisms. Community involvement and civil society engagement remain central to our national strategy. Muchas gracias. Thank you.
Thank you, Peru. Now we will hear from the Ministry of Health of Singapore.
Singapore remains committed to the UN AIDS 959595 targets and adopts a multi-pronged approach targeting each stage of the HIV care continuum. Through implementing prevention programs, expanding testing and treatment, and enhancing surveillance and outreach programs alike, the National HIV Program, under the Communicable Diseases Agency in Singapore, coordinates our economy-wide response. Today, 85% of people living with HIV in Singapore know their diagnosis. 94% of those diagnosed are receiving treatment, and 93% of those on treatment have achieved viral suppression. Our approach combines public education to reduce HIV-related stigma, expand testing options, and improve treatment access and affordability. Education and prevention efforts span multiple levels in Singapore. While overall HIV campaigns promote the ABCD approach, abstain from casual sex, be faithful, correct and consistent condom usage, and early detection, through mainstream media, targeted interventions are implemented for specific populations. Now, these efforts collectively aim to increase awareness, address misconceptions, reduce stigma, and promote early testing and prevention strategies across different segments of society. HIV testing in Singapore aims to facilitate early detection, enabling prompt treatment and preventing further spread. Now, over the years, Singapore has implemented several strategies to encourage HIV testing among different population groups, including 10 anonymous testing sites and routine antenatal screening, which has helped eliminate vertical HIV transmission since 2008. To further enhance accessibility and privacy, HIV self-testing kits have been introduced across Singapore since January 2025, providing an additional convenient testing option to reach individuals who might not otherwise get tested. Singapore's support for HIV treatment aligns with our healthcare philosophy of balancing access, affordability, and sustainability. Substantial subsidies for HIV medication through Standard Drugs List and Medication Assistance Fund reduce first-line ART costs. And through these combined efforts and in principle that no one is denied healthcare due to the inability to pay, Singapore maintains a comprehensive approach to HIV treatment and care. HIV remains a key public health priority for Singapore, and we look forward to collaborating with APEC economies in developing an actionable regional plan that advances our shared goal, ending HIV.
Thank you, Singapore. Now we move to the Ministry of Health and Welfare of Chinese Taipei.
Hi, I'm speaking virtually. My name is Philip Yiqing Lo. I'm representing the Centers for Disease Control in the economy of Chinese Taipei. So I sort of leaving out my scripts and talk more about the reflections from the previous sections. I'm appreciating the panelists of the previous session, Dan Murphy, Mr. Dan, specifically point out Taiwan as like a poster child of the implementation of various HIV-related prevention and control strategies, such as the same-day ART program and also the PrEP program. And I want to also highlight that actually the HIV prevention work does not stand alone. It actually goes hand in hand with our human rights movement in Taiwan. Actually, this year marks the 6th anniversary of legalization of LGBT marriage in Taiwan. We actually are among the first economy to do such in the region. And I also want to congratulate Thailand for passing similar law last year. And also I saw Chile was doing the same thing a few years ago. But still, we are kind of pushed by our community, which are empowered by the LGBT equalization campaign in order to achieve a lot of the debates related to HIV prevention control issues were raised a decade ago. And the reality is actually our government's programs do not change spontaneously. And this partnership was pretty tricky before the decade. Actually, the partnership were built within the campaign in order to help each other to achieve their goals in human rights and also in HIV prevention and control. A decade ago, HIV was in surging trend among MSM in Taiwan, and the same-sex marriage rights movement and also key populations' high visibility throughout the campaign when sex marriage was during the legalization process made the visibility and the voice for equal rights during such a uprising HIV trend in hot debate in both positive and negative ways. However, it triggered unprecedented attention and the politician support in the society, which further drive us to adjust the conventional HIV programs to meet communities' need. So in return, actually, the community was largely empowered, and the empowered community further strengthened or pushed the government's program to change in the positive direction. And further, we strengthened the partnerships altogether. So I think sort of using this example to illustrate the challenges in the region that a lot of public health commitment is there to use the good tools and also good models. However, we lack the resources of financing and also legalization in order to achieve those tools and targets. So I want to echo the first speaker's view of the next global AIDS strategy that number one should still be people-centered and rights-based. In order to achieve these kind of public health goals and targets, we should not only talk about targets, programs, policy, and barriers. We have to emphasize the importance of partnerships, delivery, access, and also value of equity, inclusion, and also very importantly, trust of the services that is being delivered or being planned. In order to achieve that, I want to encourage all the economies to empower your community because in return, the community will empower you. And as an example, actually in the post-COVID era, there was some discussion in our economy last year within the Ministry of Health talking about kicking out ART treatment out of the health insurance program, meaning out of the universal health coverage. But it was because of the power of the community that their voice is being heard and loudly heard that this kind of unjust behavior won't be actually succeed in the discussion. So in the end, actually, the universal coverage, health coverage still include ART treatment. So I just want to use the example to say that a lot of the weaknesses demonstrated in the discussion today illustrate that health sector should not stand alone, and we should be also empowered by APEC, also private partnerships and public partnerships in order to engage other sectors to assist in health in order to achieve the elimination of AIDS and also ending AIDS epidemic goal together. Thank you.
Thank you very much, Chinese Taipei. And now we turn to Ministry of Public Health, Thailand.
Thank you. Dear colleague and APEC economy, I'm Dr. Niti Hetanurak, Deputy Director General Department of Disease Control, Thailand. Thailand is pleased to contribute to the development of the APEC action plan to end the HIV epidemic. As of now, Thailand has an estimated 565,000 people living with HIV, with approximately 8,124 new cases a year. And the goal to end the HIV by 2030 for Thailand is less than 1,000 new cases a year. So right now, I would like to share the Thailand experience across the 5 key areas. Number 1, the challenges and barriers. Thailand has made substantial progress in HIV response. 95% of HIV diagnosed. 92% of those diagnosed on antiretroviral therapy, ART, and 98% of those on treatment achieving viral suppression. This outcome reflects our commitment to achieving the 95-95 target. However, we continue to face 3 main challenges. First, identifying people living with HIV who are unaware of their status, especially among the hard-to-reach population who often seek care less. Second, stigma and discrimination remain major barriers to accessing testing and treatment services. Third, despite a long-term decline in overall new infection, Thailand is now experiencing a rising number of new HIV infections among the youth, suggesting ongoing high-risk behavior and youth-friendly healthcare access. Number 2, strategy and politics, financial and sustainability. Thailand's response is guided by Thailand National Strategy to End AIDS 2017 to 2030 and National Action Plan. These align with global targets and are fully integrated under our universal health coverage. To enhance access to HIV prevention and care, Thailand is advancing the DAP Act on the elimination of stigma and discrimination, which is currently under consideration by the Cabinet. This act primarily aims to safeguard individuals subjected to discrimination in all forms and to ensure the genuine realization of the principle of equality. Thailand's HIV response has been domestically funded about 90% of the total program for more than a decade, with about 70% allocated to treatment and 16% to prevention. Recently, a decrease in donor funding, especially for activities led by the civil society, both leads to community outreach and prevention efforts. Thailand is now actively working to integrate this activity into the government budget to ensure the sustainability of their program. Number 3, prevention and innovation. Thailand has integrated HIV self-testing and same-day ART initiation into HIV program to ensure universal access to early diagnosis and timely treatment. Building on our long-standing condom program, Thailand has included pre-exposure prophylaxis in the UHC since 2020. This integration marks a significant step in making PrEP more accessible, particularly for key populations. Thailand is also investigating innovative technologies such as long-acting injectable PrEP to improve PrEP adherence in those who need. Additionally, the country is exploring the use of two-drug regimen for HIV treatment, aiming to simplify therapy, reduce side effects, and maintain long-term viral suppression. Number 4, sustainability and partnership. To add that long-term sustainability, we are strengthening domestic resource mobilization and exploring innovative service contact model. Community-led health services have played a vital role in reaching key populations through screening, linked to care, and PrEP delivery, supported by USC. We also see opportunity to partner with the private sector in area like diagnostic and digital health to enhance coverage and efficiency. Number 5, regional collaboration and recommendation. Thailand support enhance APEC collaboration to promote peer learning, share innovation, and jointly assess barriers in service delivery and financing. We recommended that the APEC action plan prioritize community-led service delivery model to effectively engage hard-to-reach and underserved population, ensuring equitable access to HIV services, support technical assistance and innovation transfer within APEC economy, and foster legal reform and multi-sectoral partnership, especially with education, labor, and justice sector, to systematically dismantle HIV stigma and discrimination. In closing, Thailand remains strongly committed to ending the HIV epidemic and advancing UHC. We look forward to collaborating with APEC economy to build a more inclusive, resilient, and equitable HIV response. Thank you.
Kapkun Krab, Thailand. Are there any other economies in the room that would like to intervene? Yes, please introduce your economy.
Everyone, we are from the Philippines. So as shown in the graph earlier, we have the highest in terms of the increase of cases. So I'll discuss based on the sharing earlier regarding the 3 enablers. So the Philippines is committed to address the HIV epidemic. In fact, in terms of funding, we have increased funding for HIV program, and even for our social insurance, we have increased the package for HIV. It's almost double package or benefit for our HIV. In terms of innovation, we have already introduced the PrEP, and we are aware of the new preparation of the PrEP, and I think that this is one of the bottlenecks that we have with our UHC law. If you will introduce a new technology, it has to undergo the health technology assessment. So I think what can be assistance that can be provided would be the provision of information to the Health Technology Assessment Committee to facilitate the assessment of the use of the new technology. Then in terms of the services, I'm not so sure of the 3rd enabler. It's differentiated services. Is that correct, sir? Okay. So in terms of the differentiated services, so we are doing this and we are integrating our services with the maternal health. Since we have the mother-to-child transmission, we are addressing that. Then we are also integrating with the TB program and the primary care. In fact, HIV is one of the 8 priority health outcomes of our Secretary of Health or of the country. Then in terms of the challenge that we're having is our services for HIV is not being provided to all areas. So we are doing this only in areas that have high cases in terms of our surveillance. So what we are doing now is we will be doing expansion of the services in terms of the diagnosis and in terms of the treatment. And I think one of the challenges also is the limitation of the policy. We have in our law, it states that the for testing, we need to have a consent of the parents. So we are addressing this, and so we are addressing this. So in terms of the testing consent, we did the revision already, but one of the things that we need to address would be the ensuring that if they are tested, they should be provided with the treatment. I think that's one of the things that we need to address. And actually, in terms of commitment to address the the HIV problem, we already have a upper level discussion, even with our president, if we can have an executive order so that we can address the HIV problem, especially the increase, the very recent increase in the number of HIV cases. So that's all. Thank you.
Thank you very much, Philippines. Are there any other economies in the room that would like to intervene at this time? Okay. Seeing none, we will continue. What a wonderful session that was. I think this is, as I said before, really the most important part of these APEC policy dialogues for the economies to share challenges, opportunities, solutions. So appreciate all the economies who shared today. A very rich and dynamic conversation. Now, as part of our next session, from dialogue to action, synthesis, and next steps, I'm just going to summarize some of the key points that I heard from the economies. I'll also preview the APEC action plan process so that everyone is aware of our next steps. And I'll invite all of you to continued collaboration in that process. But first, let me reflect on some of the cross-cutting themes that I heard from all 7 of our economy interventions, which is terrific. The first major theme, strengthening early detection, rapid linkage to care, and equitable testing access. Several economies touched on this, expanding testing access and accelerating a linkage to care. Philippines very helpfully emphasized the importance of making sure parental consent laws are suitable, and similar concerns were raised by Japan, Chile, and Singapore around early detection and stigma-free testing, as well as Peru. The second cross-cutting theme that I observed was tackling stigma, legal barriers, and structural exclusion. Of course, stigma and legal barriers remain a persistent challenge. There were a number of interventions, including Chile, Chinese Taipei, Peru, but really all of the interventions emphasize the importance of eliminating stigma and ensuring that the HIV response is grounded in equity, trust, and inclusion. The third cross-cutting theme that I heard in the economy interventions was scaling biomedical innovation in differentiated service delivery. So building on the helpful enablers from Dan and the Next Mile paper, there was discussion about new PrEP options and how to pave the way for new PrEP options, including those that require health technology assessment in certain economies, very helpful to remember. Discussion about product introduction not being enough on its own. So there was talk from several economies about evidence generation, policy alignment, and regulatory readiness as well, including in differentiated models and same-day service access for youth and other key populations. The second last cross-cutting theme that I heard, financing sustainability and innovative partnerships. I think across the board, economies raise the need for sustainable and increased HIV funding. Philippines discussed their expanded funding and new models of service delivery, linking care with maternal health and primary care. I recognize that Bridget from UNAIDS also highlighted the importance of integration with mental health, which I know is a priority of Peru as well. And all economies talked about geographic equity in their service delivery. I especially appreciated Peru's mention of indigenous peoples as a key population to consider, and economies talked also about lower resource and rural areas as well. And the final cross-cutting theme that I think we all heard during the economy interventions was youth and vulnerable populations being a rising and worthy priority. It's very concerning, the increase in incidence among youth for HIV. Youth, indigenous peoples, underserved communities, economies are working towards all of those underserved and vulnerable populations. And Singapore talked about the importance of inclusive messaging and ways to get the message out, both targeted but also in mainstream media, messaging that's youth responsive and community driven. And Chinese Taipei also talked about rights-based approaches to messaging as well. So hopefully this provides a accurate summary of where we just were in terms of economy interventions. I think they align quite nicely with the 6 core challenges that our experts identified in the APEC issues paper. And it really sets us up for success in terms of what's next. So what is next? Building on today's discussion, the project team, led by our project overseers, our co-sponsoring economies, and our expert network, will finalize the issues paper. That's the first thing. We got a lot of great comments and feedback on the APEC issues paper. We will finalize that and circulate that to all of you and to the APEC Health Working Group probably sometime in the next week to 10 days. We will then build on that to start developing a 10 to 15 page APEC action plan to end the HIV epidemic, which we aim to finalize by November 2025 and put forward for APEC Health Working Group endorsement. The action plan will propose specific strategies and policy recommendations aligned with 95 and aligned with the 90% incidence reduction target from UNGA. It will, building on and learning from other action plans and roadmaps, as Robert mentioned earlier, it will identify opportunities for collaboration, particularly around prevention, funding, legal reform, and other barriers identified in the issues paper. Very importantly, the action plan will include options and ideas for capacity building and follow-on APEC projects. This project is the first in many, many years, possibly ever, that focuses on HIV. It's at least been probably a decade since the Health Working Group has had HIV on the agenda. And this is just the beginning. There could be follow-on projects that are led by member economies that implement the action plan. And importantly, in addition to endorsement by the Health Working Group, it might be of interest to the co-sponsors and to the economies in the room to seek endorsement by APEC health ministers. At the very least, we do have an expression of interest from our project overseers and our co-sponsors that health ministers receive a letter from our sponsoring economy informing them of our work and our mission. So health ministers will be informed through formal communication at the HLM this September. So in closing, before I turn it back over to Dr. Campos to close the meeting, as we move forward towards the action plan, your continued input and leadership is critical. Not only our co-sponsors and our sponsor, but all APEC economies. If you have not yet nominated an expert to join the APEC HIV Expert Network, we strongly encourage you to do so. If your economy is interested in leading aspects of the drafting or implementation of the action plan or sponsoring follow-on projects, we welcome that leadership. If you're from the private sector or civil society or academic and clinical communities, or if you're a person living with HIV, we encourage you to stay engaged as we move toward concrete outcomes. And Importantly, we look forward to working closely with China to carry this momentum forward in 2026 during the APEC year in China. So thanks again for your participation today, and I will turn the floor to our Health Working Group Chair, Dr. Campos, for his closing remarks.
Thank you so much, Eric. Dear representatives, delegates, and colleagues and friends, as we bring this important dialogue to a close, I want to thank each of you for your thoughtful participation, for the insights you have shared, and for the commitment you have made. I would like to thank you, Robert and Dan, from the private sector, for the honest and very clear thoughts. Also for all the delegates with your participation in your economies, and of course to our project overseer, Dr. Leonardo. Such a great job for this first policy dialogue. And Eric, as a moderator, you did an amazing job. Today's discussions have been both sobering and inspiring. We heard clearly the HIV epidemic is not over, and neither is our work. Throughout this evening, we heard from economies across the region, from those making extraordinary strides toward these triple 95 targets, to those confronting steep and urgent challenges. We spoke of stigma and silence, of legal and policy barriers, of underfunded prevention efforts, and of care models that are not reaching the communities most at risk. As mentioned, Eric, I'm so impressed about the stories of, for example, in the case of many economies, gender trans women in the cities who has difficulty to access because of a stigma, and also indigenous people in the Amazon area in Peru. Yet we also hear examples of innovation, of resilience, of community-led impact, and of economies adopting bold new approaches, such as scaling up rapid diagnostics, long-acting PrEP, or same-day treatment initiations. We are not starting from zero. We are building on decades of science, systems, and solidarity. The thread that connects all these efforts is leadership, political leadership, institutional leadership, and community-driven leadership. We must now take ownership of this path forward. APEC can serve as a powerful platform for regional cooperation on complex health challenges, and HIV must be on no exception. Ending the HIV epidemic cannot be treated as a technical exercise alone. It requires sustained political prioritization, partnership across sectors, and courageous reform. I call on each economist to reaffirm that HIV is a regional priority, not only for the health sectors, but also for the finance sector, for the justice, and beyond. Your inputs today will directly inform the APEC Action Plan to end HIV epidemic, which we look forward to drafting through the rest of the year, hopefully by November this year. That action plan must be grounded in what we have heard, the urgent need to scale solutions, fund that works, remove structural barriers, and strengthen regional coordination. Peru, our country as a co-sponsor of these initiatives, remains committed to supporting the development and implementation of the action plan. I'm pretty sure Chile too. And ensuring it becomes a living document that drives change on the ground. Thank you for being part of this critical step forward. The task ahead is clear, and together we can end the HIV epidemic in the APEC region. Let's begin today with a shared leadership, regional ownership, and unwavering commitment. Thank you very much.